Follow me, because by the end of this video, you'll wonder how you spent all this time without knowing this important information. Heart is dying. 11 weird signs of heart damage you must not ignore. 99% of people don't know. You might think your heart is fine, but what if I told you that right now it could be silently calling for help and you wouldn't even notice? The truth is, heart damage doesn't always scream with chest pain or dramatic symptoms. Instead, it whispers through strange, unexpected signs that most people ignore until it's too late. Today, we're diving deep into these weird signals your heart is sending and why ignoring them could be a fatal mistake. Stay with me, because what you're about to learn might just save your life. Your heart is a powerhouse, beating over 100,000 times a day, pumping around 2,000 gallons of blood through your body. But just like any machine, it shows signs of wear and tear. While we all know the classic symptoms of heart issues like chest pain and shortness of breath, the real danger lies in the silent killers, the odd, seemingly unrelated signs that most people never connect to heart problems. Let's uncover them one by one and understand why your body is giving you these red flags. One shocking sign is swollen feet and ankles. You might blame it on sitting too long or eating too much salt, but persistent swelling can mean your heart isn't pumping blood efficiently. When blood flow slows, fluid can accumulate in your extremities, leading to swelling. According to the American Heart Association, this can be an early warning sign of congestive heart failure. Another bizarre symptom is persistent jaw or neck pain. While many link this to dental issues or muscle strain, it can actually signal an impending heart attack. Studies have found that women, in particular, experience jaw discomfort as a sign of heart trouble more than men. If your jaw pain is accompanied by nausea, dizziness, or fatigue, your heart may be crying out for help. Then there's extreme fatigue. Not just the usual tiredness from a long day, but overwhelming exhaustion that doesn't improve with rest. In a study published by the Journal of the American Heart Association, nearly 70% of women who suffered heart attacks reported unusual fatigue weeks before the event. If climbing the stairs or doing routine activities suddenly feels like running a marathon, your heart could be struggling to supply enough oxygen to your body. Did you know cold sweats can also be a sign of heart trouble? Waking up drenched in sweat, especially without any clear reason, like a hot room or fever, can indicate that your heart is working overtime. Excessive sweating, particularly if accompanied by dizziness or shortness of breath, is a telltale sign that something is off with your cardiovascular system. Digestive issues like nausea, indigestion, or even vomiting can also be linked to heart disease. You might chalk it up to something you ate, but research shows that many heart attack patients report experiencing stomach discomfort before their cardiac event. This happens because the nerves that supply the heart also interact with the digestive system, making it easy to confuse the symptoms. An often overlooked warning sign is sleep disturbances. If you constantly wake up, gasping for air, or snore loudly, it could be linked to sleep apnea, a condition strongly connected to heart disease. Sleep apnea causes repeated interruptions in breathing during sleep, increasing blood pressure and putting extra strain on the heart. Studies show that people with untreated sleep apnea are twice as likely to experience heart-related issues. Ever felt dizzy or lightheaded when standing up too quickly? While occasional dizziness is normal, frequent episodes could indicate blood flow problems. When your heart struggles to pump blood efficiently, your brain gets less oxygen, leading to dizziness. This could be an early sign of heart valve disease or an irregular heartbeat. Irregular heartbeat, also known as arrhythmia, is another silent danger. Occasional skipped beats are common, but if you frequently experience palpitations or a fluttering sensation in your chest, it's time to pay attention. According to the National Heart, Lung, and Blood Institute, arrhythmias can increase the risk of stroke and heart failure if left untreated. Did you know gum disease can be connected to heart health? Poor oral hygiene and inflamed gums can lead to bacteria entering the bloodstream, triggering inflammation in the arteries and increasing the risk of heart disease. Research from the European Journal of Preventive Cardiology found that people with gum disease are more likely to develop cardiovascular problems than those with healthy gums. Another odd symptom is skin changes. Blue or purple fingers, known as cyanosis, signal poor circulation and lack of oxygen in the blood.